Hi everyone, my name is Adithya Gurumurthy and I will be presenting my work titled Computational Analysis of Helical Aerosol Streams for Controlled Micro or Nano-Drug Delivery in Representative Human Upper Lung Airway Model. For an overview of my presentation, I'll be starting off by providing a brief introduction related to controlled pulmonary drug delivery, which leads way for motivation and scope for this work. Following which, I'll be discussing the upper airway geometry and the in silico approach used for this study under the theory section, which is then backed by the model validations. The effect of helical streams for pulmonary drug delivery will be discussed in the results and discussion section, and finally conclusions and future work will be presented. Pulmonary drug delivery has gained increased attention over the past decades due to their non-invasive nature, direct applicability, and hence increased efficacy. Due to this, it is also becoming the preferred route for treating pain management, systemic diseases, and for insulin delivery. Some of the devices that facilitate pulmonary drug delivery include metered-dose inhalers, dry powder inhalers, and nebulizers. However, there are a few barriers to its performance, of which mechanical barriers that include wastage of drugs in the oral or nasal cavity due to interception and impaction poses as the first hurdle. This is observed in the first figure, where 50% of inhaled drugs are deposited in the oral cavity, leaving only around 40% for the deep lung. Controlled or targeted drug delivery can be effectively used to overcome such barriers. This can be achieved by modified inlet conditions, mouthpiece designs, and auxiliary devices, and drug formulation. The present study focuses on modified inlet conditions, particularly with the use of helical aerosol streams. Another major health concern is lung cancer, which is responsible for almost 25% of all cancer deaths. Although chemotherapy is primary treatment regimen, earlier stages of cancer like the non-small cell lung cancer can be treated via pulmonary route by nano-drugs. Unfortunately, there is still a problem of wastage of drugs in the anterior region of the oral cavity. This not only leads to drug-induced toxicity, but also limits the availability of drugs at target sites and ultimately reduced efficacy. Thus, it is key to consider the effect of nanoparticle transport while investigating new targeting methodologies. Modified inlet conditions are an effective way of overcoming mechanical barriers without the need for new drug formulation or treatment regimen. Their applicability has been demonstrated in several studies. For example, in 2007, Kleinstra et al. Showed via in silico and in vitro studies the possibility of controlling particle trajectories by altering the injection position. Another demonstration of this was shown in 2017 by Colangelo et al., where they observed reduced oral deposition fraction of drugs from 49% to 44% by incorporating an angled aerosol stream, considering DPI profiles. For this study, we introduced a recent methodology of incorporating helical streams characterized by the non-dimensional swirl number and expand their scope to nano-drug delivery. Recently, we showed the applicability of helical flows in pulmonary drug delivery to reduce the overall oral deposition fraction from 60 to 37%, considering micron-sized particles suitable to PMDIs and soft mist inhalers. However, it is also essential to analyze the effect of helical streams on nano-drug transport. In addition to widening the scope of helical aerosol streams, critical insights can be gained by conducting in silico simulations and analysis. Effect of helical aerosol streams have been analyzed on realistic upper airway geometries, which have been obtained by scanning wax model used by Su and Cheng in 2006. It comprises of oropharynx, larynx, trachea, and bifurcations up to generation 3. For the purpose of conducting regional deposition studies, the upper airway geometry is divided into zones Z1 to Z6 as shown in figure. For conducting in silico studies, the geometry is discretized into around 7 million elements after conducting grid-independent studies. CFPD or computational fluid particle dynamic simulations are conducted by modeling the fluid flow using a RANS approach with SST K omega turbulence modeling and incorporating Lagrangian approach for particle tracking. The helical flow inlet characterized by S is specified at a representative mouthpiece inlet, which is highlighted in blue. Finally, the results obtained by the model is post-processed for gaining additional insights. Any additional information regarding the in silico approach is available in our recently published article. For all computer experiments, user-enhanced version of OpenFOAM has been used. The applicability of our model to predict particle deposition in human airways is confirmed as our results are in good agreement with earlier in vitro and in silico studies. For nanoparticles, our model also predicts the lateral displacements of particles due to Brownian motion accurately, as can be seen from this figure. Helical aerosol streams have been analyzed for MDI and SMI profiles in this study. Typical conditions for such profiles are given by Wei et al. Are as shown. In our present study, micro and nano-drug transport and deposition are analyzed for low inhalation profiles corresponding to 10 liters per minute and elevated profiles corresponding to 30 liters per minute. This is carried out to critically analyze the effect of particle inertia and hence the deposition mechanism. The oral deposition fraction versus swirl number corresponding to nano-sized particles in aerosol streams is shown in this figure. It can be observed that as the swirl number increases, the deposition fraction of particle shows a reducing trend up until a certain swirl number value, which is termed as the swirl number threshold, which is highlighted in figure. As the swirl number is increased beyond the threshold value, an increasing trend is observed. Also, for any given swirl number, smaller sized particles feature an increased deposition fraction due to Brownian motion. Considering micron-sized particles, the decrease in trend in deposition fraction with increase in swirl number is not observed for all particle sizes. This is due to the effect of sedimentation in micron-sized particles. As swirl number reduces particle inertia, they enhance gravitational settling, which is significant for these particles. The quality of helical flows to reduce particle inertia can be perceived by observing this figure. Concerning an axial jet, figure on the left, there exists a hot spot in deposition fraction which is highlighted, which occurs due to inertial impaction. This is not observed for a helical stream for the figure on the right. However, there is an increased deposition fraction due to sedimentation for a helical stream, which is evident by particles deposited in patches normal to the gravity vector. Thus, helical flows aid pulmonary drug delivery, denoted by critical threshold swirl number. They also enhance particle deposition due to Brownian diffusion for nano-sized particles and sedimentation for micron-sized particles. Results from regional deposition study confirm this phenomenon. Deposition of particles in zone Z1 to Z6 are shown for different streams corresponding to swirl number of 0 to 1, which are depicted by bins blue to magenta. It is evident that for nanoparticles, the overall reduction in deposition fraction is primarily due to the reduction in deposition fraction in zone Z3, which encapsulates the hot spot in particle deposition due to inertial impaction. A similar trend is observed for micron-sized particles, but beyond swirl number of 0.2, for particle size of 5 micron, there is an increase in deposition fraction in Z3 due to sedimentation. For both 50 nanometer and 5 micron particles, increase in swirl number causes increase in deposition fractions in zones Z1 and Z2. This is due to the increased recirculating zones created, which causes increased particle residence times and hence deposition due to Brownian diffusion and sedimentation. Hence, the reduction in deposition fraction in Z3, which contributes to overall reduction in oral deposition, is attributed to reduced axial inertia of helical flows. Increased deposition in Z1 and Z2 arises from Brownian diffusion and sedimentation. Considering elevated inhalation profiles for nano-sized particles, as observed earlier, increase in swirl number until the threshold value causes the deposition fraction to exhibit a decreasing trend. The deposition profiles for particle sizes appear to be more cohesive because at such elevated profiles, Brownian diffusion is not very significant and hence particles follow streamlines more readily. For micron-sized particles, conversely, to what was observed earlier, the increase in swirl number now causes an overall reduction in deposition fraction. This is because at such elevated profiles, effect of helical flows is significant enough to reduce inertial impaction and at the same time not very high to cause sedimentation. The threshold in swirl number changes as the particle size increases, which causes sedimentation to become more predominant. The effect of helical flows to reduce inertial impaction is clearly described in this figure, which denotes the absence of the hot spot in S is equal to 1 case for the figure on the right. Thus, a more consistent trend is observed for elevated inhalation profiles, thereby confirming the efficacy of helical streams for drug delivery for both micron and nano drug aerosols. As observed earlier, the regional deposition fraction confirmed the capability of helical flows to reduce deposition fraction in zone Z3, which features the hot spot due to inertial impaction. This is evident as the deposition fraction reduces when the swirl number increases. A similar trend is observed for micron-sized particles for both cases. However, helical flows seem to cause an increase in deposition fraction in Z1 and Z2. This is due to Brownian diffusion and sedimentation. Zones Z4 and Z5 remain minimally affected. Another major implication is the capability of helical flows to deliver drug to deep lung. This is highlighted by the fraction of particles transferred to outlets of G3. For a volumetric flow rate of 10 liters per minute, considering both micron and nanoparticles, helical flows seem to deliver increased dosage to deep lung in comparison to axial jets. This is evident from this figure where helical flows corresponding to S is equal to STH or the threshold swirl number deliver increased dosage to outlets for both micron and nano-sized particles. This is more significant when the flow rate of 30 liters per minute is considered, as helical flows primarily work to reduce inertial impaction, which is significant by reduced deposition fraction in mouth-to-throat region. It can be observed that increased dosage can be delivered to generation 4 and beyond for both nano and micron-sized particles when switching over to helical flows. Thus, helical flows deliver increased dosage to regions beyond generation 3 due to their reduced emission fractions in Z3. Their effect is more pronounced, however, at elevated inhalation profiles. Thus, to conclude, helical aerosols feature reduced inertial impaction over an axial jet. Their applicability for pulmonary drug delivery is denoted by critical swirl number threshold (SDH). For example, they are applicable to nano-drug streams where they reduced 59%, where we observed 59% reduction in the oral deposition fraction for 15 nanometer particles when switching over to a helical stream. They primarily affect particle deposition in the oral cavity, and their effect is more pronounced for elevated inhalation profiles. They increase the availability of drugs to generation 4 and beyond. Some of the limitations of our study, which will be considered in the future, are as follows. Mouthpiece capable of generating desired helical stream was not considered. However, a prototype generated by mimicking streams of the best S is being analyzed presently. Inhalation profiles correspond to dry powder inhalers, which will be accounted for in the future. The fate of inhaled particles beyond generation 3 was not analyzed here, but will be done in the future considering a whole lung airway model. Thank you very much for your attention. If you are interested in our work or for any additional information, please reach out to us.